Well, in terms of the radial patient, it's more beneficiary for the patient. The patient have a lot of more independence. The patient could actually sit up right away, you know. Um, they could ambulate to the bathroom as long as the vital signs are stable, the blood pressure is fine, decrease amount of bleeding because some of the patients, when you instruct them to keep the head down, the right leg straight, they tend to sit up, and that could cause hematoma or bleeding. In terms of the radial, they could move their hand, they just can't put pressure on that hand, but they could move their arms. Once you instruct them, okay, you don't put pressure on that hand, they move, they move both legs, both arms. But when you do the groin, like the femoral, they have to lay down flat for about 4 hours. They tend to cross the legs. You have to keep looking at them. Please don't do that. You're going to bleed in the groin, and then we got to give them the reason. If they bleed under the tissue, they could end up in the operating room to evaporate the blood, that collected under the tissues and stuff like that, and they tend to. But you have to be on the patient all the time, so, they don't move. It's easier for me, and think for nurses too. It's much less work.